What's up, beautiful people? Welcome back to my channel. Now this video is long overdue. I remember I kept telling you all I'm coming back with a lot of sit down content. In this video today, we are going to discuss The Good Nurse. The Good Nurse is a movie based on a true story. It's currently on Netflix. I suggest that you watch it and probably come back and look at my review. That way it fills in the gaps for things that you may not understand what I'm referring to in this review. So if you haven't seen it, go watch it and then come back and watch this. The Good Nurse tells a story about Mr. Charles Cullen, who is currently in prison, and I believe he's serving a 5-year sentence. Mr. Cullen, a very despicable individual, worked as a nurse for, I believe, 12 to 14 years. And throughout his nursing career, this man basically was unaliving people, like straight up murdering his patients. And I believe, based on some things that I read, the total amount of patients that is believed to have been unalived by Mr. Cullen, the number is 400. Like, this man literally up to 400 people, and who knows, maybe even more than that throughout the 12 or 14 years that he was a nurse. Now the movie tells of his co-worker, Nurse Amy, who happens to be a fabulous nurse. She played a key role in taking Mr. Cullen down. So let's go ahead and jump into it. But before we jump into it, I want to talk about the fine detective that was in that movie. Now, I know he is the husband of Kerry Washington. You guys know Scandal, Kerry Washington. That's her husband. His first name is Namdi, and the man is fine. Okay, I just wanted to get that out of the way, that I was looking at the movie like, whew. This review, I took notes on my iPhone, and I also have the Netflix app on my phone, that if I needed to refer to a specific scene within the movie, I may just hold it up to the screen, because I am not technologically savvy at all. Like, I need to get up on all these YouTube tricks and all these editing tricks of how to have the clip on my screen. Like, I don't know how to do. The first things that I questioned about this movie was the nurse's station and why it was so dark. Did anyone else notice that? Like, it was really dark in that hospital. And I'm like, I know this is supposed to be night shift, because both nurses, Nurse Amy and Nurse Charlie, they worked, I shouldn't call him Nurse Charlie. Charlie worked night shift, but why was the nurse's station so dark? I've worked night shifts before, and yes, we do turn off some of the lights or dim the lights just to give that night effect. You know what I mean? Like, we don't need all these bright lights on night shift, but their nurse's station was super dark. I was just like, what is going on here? So that's one of the first things I noticed. The main character, Nurse Amy, really stood out to me, and I related to her on so many levels. And I was also triggered by her situation and everything that she was going through on many levels. I think I said it in the previous video, like, guys, I was so triggered because Nurse Amy is a great nurse. Like, excellent. And there are nurses like Nurse Amy working in direct care at the bedside. There are nurses like Nurse Amy who just wants to do the best for their patients regardless of what's going on. If you noticed in The Good Nurse, they were understaffed, because remember, there was one point where the manager and her were having a conversation in the office, and the manager basically said, oh, well, I got you guys some help on night shift. Guys, working short staff is no joke, especially when you're the kind of nurse that wants to provide the best care, top-notch care for your patients. It can be so morally distressing, emotionally taxing, physically taxing. And let's talk about the physical part. Did you all notice that with Nurse Amy, with her patient that was on the ventilator, right? This nurse embodies so many good things about what it means to be a nurse. When she was caring for that patient on the ventilator, notice that she was doing the repositioning with no help. She was also talking to the patient. I remembered her having a conversation with the patient saying, I believe I saw your sister the other day or something like that. Keep in mind that this patient is on a ventilator. I don't know what the medical diagnosis for this patient is, but as nurses, we are always taught to talk to your patient. Even if they're not awake, even if you think that they're non-interactive, non-verbal, they're not interacting with you, you must always talk to the patient. And Nurse Amy was doing just that. And that just, it resonated with me, because working on the ICU and also working on a med-surg unit where I care for vent patients, sometimes when they're not awake, when they're not aware of what's going on, I still have conversations with them. I explain to them what I'm doing. I tell them what month we're in, what year it is, what season. I try to keep them up to date on current events, like who's the president, what's going on in the news, what holiday just passed. And when I saw like Nurse Amy repositioning that patient and giving care to that ventilator patient, it just, honestly, it just really touched my heart, because it's so important when you are caring for a patient in such a vulnerable state. And that is one thing I like to explain when I was a clinical instructor to my nursing students, is that when you have a patient that is nonverbal, non-interactive, they're on a ventilator, they depend on you for everything. You are that patient's eyes, their ears, their nose, their skin. You have to be able to anticipate their needs. For example, you don't know if that patient's in pain, unless of course the blood pressure is elevated and the heart rate's elevated, right? But sometimes patients can be experiencing discomfort and they can't verbally tell you. You as the nurse have to anticipate that. A patient could be nauseated and they can't tell you. You have to anticipate those things as a nurse. So when I watched Nurse Amy giving care to that complete care patient, it just reminded me kind of myself and of all the wonderful nurses out there that go above and beyond, specifically for patients who cannot hold them accountable. Nurse Amy's character has so many layers. I'm thinking that I might have to do a part 1 and a part 2, so that way I don't make the video too long. The other thing about Nurse Amy that resonated with me and that also triggered me was that Nurse Amy was suffering from a cardiac issue. So she was not well. However, this was a new job for her. Her health insurance had not kicked in, and she did not want for her colleagues and management to know that she was suffering from this terrible cardiac condition. I think it was cardiomyopathy. She basically needed a heart transplant, and she was just working enough to try to make it through the year so that way her health insurance could kick in and that way she can get paid time off to have her surgery. And that was just so distressing to watch, because to think that this is a nurse going in and doing her very best every shift for her patients, and she is in need of healthcare and she's in need of a surgery, and she can't get it. She can't get it. She's basically suffering in silence and putting herself in more risk, to the point where when she went to see her doctor, if you all watched it, remember the doctor telling her that you can possibly have a stroke and you need to educate your 2 daughters on what to do in the event that you are having a stroke. They need to know the signs, the symptoms, and they need to be able to call 911. So these are all of the things, on top of being an excellent nurse, she was dealing with her own personal problems. And despite that she had her own personal health problems going on, she still came in and did her very best. And to think that she couldn't get help from her job, even though she was giving them 100%, 110, 150% she was giving them. Like, that was just really hard to watch, because she was really sick. She was really sick. Watching that made me question all over again, because I question it all the time, the state of healthcare in this country and what people have to go through when they have chronic illnesses or when they have a condition and they have to work and wait for their health insurance to kick in. Some health insurance, some companies, it takes like 3 months. Others, it starts immediately. Some people have to wait a year, work for up to a year before they get health insurance. And that's just a huge problem. Like, no one should have to go through that, especially as a law-abiding, contributing member of society. That was really hard to watch for Nurse Amy. Like many nurses who work in direct care at the bedside, Nurse Amy suffered from immense mother's guilt, something I have struggled with throughout my nursing career and still continue to struggle with. It's not as bad for me because I have made a decision to not sacrifice time with my children and to not miss any more events that is important in my children's life, because earlier on in my nursing career, I missed out on so many things, especially working full-time, where I had to adhere to a holiday schedule, weekend schedule. I make my schedule 4 to 6 weeks in advance, and I didn't know that my daughter had a soccer game on that specific day that I was signed up to work, or I didn't know the school's Christmas play was going to fall on the Friday that I had to work. Because working as a nurse at the bedside, I've mentioned it before in earlier videos that you're required to work a certain amount of holidays, a certain amount of weekends, a certain amount of Mondays, a certain amount of Fridays, and if you miss any of those, trust and believe that they will ask you to make it up. It is mandatory that you have to make it up. So that part of Nurse Amy's life also triggered me, because it took me back to when my daughters were much younger and I missed out so much of their life. Nurse Amy appeared to be, I guess, I don't know if she was married or if, I don't know, whatever, but she was a single mom to 2 young girls, and she worked a lot because she had to provide for them. And so she would always leave them in the care of a babysitter who, I forget the babysitter's name, but an elderly woman. The one thing I want to point out is that at least Nurse Amy was sure to leave her children with a very safe provider, a very safe person to care for them. Because oftentimes as single mothers who work, you go out into the workplace to earn a living to take care of you and your children, and you leave your children or your child with somebody who ends up doing something very horrible to that child. So I was very happy that at least with working the way that she did, she had a safe place to leave her children. So that right there was, I was very happy about that. I was very sad though to know that her children missed her, and they missed her a lot. And if you notice, her oldest daughter had moments where she would lash out and act up, and Amy knew the reason why her daughter was always lashing out and acting up, but what could she do, right? She can't quit her job. She had to work. And the thing is with nursing, a lot of people will say, but you guys only work 3 days a week, 12 hours. So here's the thing with nursing, especially if you work at the bedside. 3 days a week, 12 hours, that's 36 hours, right? So we're not even fully at 40 hours a week. We make okay money as nurses, but the reason why people think nurses make so much money, it's not based on our base salary. It's not based on the minimum amount of hours that we work. It's based on working extra, picking up overtime in order to make ends meet, or in order to do a little bit extra for your family, a little bit extra for your children. So most nurses that work in direct care at the bedside, we're not working the standard 3 days a week. Sometimes we're picking up an extra shift, which makes it 4 days, 12 hours. That's 48 hours, just so we can afford to like maybe pay for an after school activity. Or like Nurse Amy, you have to now pay for daycare and childcare as she was doing. So she was working for that. Also keep in mind that Nurse Amy was also seeing a doctor for her cardiac condition that she had to make payments out of pocket. Like, did you guys hear that bill when she was leaving and they said, oh, it'll be $900? And it was just like, and she quickly negotiated and said, well, can I pay you half today? So a lot of times people think, oh, nurses, you guys make a ton of money. We don't. And when we do get a really nice, decent paycheck, we put in the work for it. Like sometimes 5 days a week, 12-hour shifts. And I tell you, those 12-hour shifts are no joke, because you're taking care of patients who are super sick. And you have to put your problems aside. You have to put the fact that you have children at home aside to provide the best care. And not only are we dealing with patients, we're also dealing with the families. And sometimes they're not kind. I can go on about Nurse Amy. Another thing about her that resonated with me was her ability to humanize and relate to not only to the patients, but also to their families. You all remember in that scene where the elderly gentleman, his wife was in the bed and she was NPO, meaning that she could not have nothing by mouth. And Amy basically told her, no, you can't have anything to drink today, but maybe tomorrow. Remember, the husband kept telling the wife, okay, honey, I have to get ready to leave because visiting hours are about to be over. And what Nurse Amy recognized in that moment was it was better to have the husband stay overnight. So what Nurse Amy did was she offered him a recliner chair and a blanket. And I have done so in many situations where I knew it would benefit my patients more to have their loved one, their husband, their sister, their mom, stay with them overnight, right? That I, like Nurse Amy, was willing to break policy in order for my patient to be comfortable. And when she did that, I was just like, who is this nurse? Who is this woman? Like, her story should have been told a long time ago. Outside of like being the good nurse, outside of that whole Charles Cullen murdering those patients, Nurse Amy herself, a documentary should be done on her, because just the way that she cared for her patients and her family members, other nurses need to see that. Like, she put her patient's care at the top. Forget your hospital policy. Forget that visiting hours are over at 8. If it's going to benefit my patient and provide my patient with a peace of mind and comfort and help them sleep good during this hospital stay, sure, you can stay overnight. Here goes a blanket. Here goes a recliner chair. I didn't see you. You didn't see me. We here, okay? And remember, Nurse Amy actually got in trouble for that. She got pulled up by her manager, because when she was in the office speaking with her manager, the manager was like, oh, you let your patient's husband stay overnight. And she basically said, well, what should I have done? It was dark and it was late. Let him go home. So sometimes as a nurse, we find ourselves we can find ourselves in tough spots, in tough situations where we're trying to balance and juggle policy versus what is the right thing to do as a human being. Because at the end of the day, we're all human beings. I'm a human being first before I'm a nurse. And I always find myself humanizing my patients and humanizing their families. So in that moment, Nurse Amy made a human decision. She recognized that this is an elderly gentleman. His elderly wife, who he loves and she loves him, is laying in the hospital bed. Should she let him leave and go home in the dark, in the cold, when he could just stay overnight just for a couple of hours? I respected that so much about Nurse Amy. Other scene where she really touched my heart also, Nurse Amy, was when she was taking care of the postpartum mom whose husband was at the bedside with the baby. Wait, I don't think the mother was postpartum. My bad. Take me back on that. I'm thinking because the husband had a baby, she was postpartum. But the baby was only 6 months. And remember that he was visiting the mother with the baby. Now, most hospitals, the policy, especially in ICUs, is that no children allowed. Children have to be at least age 12 and above. Some institutions have it to where the child has to be age 14 and above. But working on that night shift, Nurse Amy came in. She had this patient who was a mother to a 6-month-old baby, and the husband was at the bedside with the 6-month-old baby. Now, I have seen nurses be so mean to patients with children, or just to, not patients with children, but to family members who's there with a small child, and will say things like, you have to leave, or you can't have the child in here. Like, I don't know what to tell you, but you can't be here. Like, they don't humanize the actual experience, the actual reality of that person. Now, this father stated that him and his wife didn't have anyone to watch the baby. So he wanted to be there with his wife and visit with his wife. What else was he supposed to do with the baby? Or was he not supposed to visit his wife at all? Was this baby now not supposed to see her mother or be able to hear the mother's voice because of hospital policy? And the fact that Nurse Amy didn't even say to him, hey, you have a baby in here, you're not supposed to. Again, like, she just embodies so many good qualities. Like, I was so impressed. I think with this movie, The Good Nurse, a lot of people are really, they took from it, just like I did too, the fact that, oh my goodness, this man was so horrible. He killed all his patients. But honestly, Nurse Amy resonated with me more than that part of it, because she was just overall such a good person. And I kept saying to myself, like, wow, if the world can just have people that had the same qualities as Nurse Amy, if within nursing, every single nurse was to embody the kind of characteristics that Nurse Amy had, like, healthcare would be so much better, nursing outcomes would be so much better. Like, I think the world would be just so much a better place with people like that in it. Amy didn't even say to him, you can't be here with your child. As a matter of fact, when she got the phone call or the page that it was a code purple, meaning that the pizza in the break room had arrived, she recognized that, okay, he's here visiting his wife. He has a baby. I don't even know if this man has eaten. She offered him pizza. She offered him pizza. And I was like, Like, that just put faith back in me that they are good people. And like I said, I'm not trying to compare myself to Nurse Amy or say, oh, well, I'm a bomb nurse too, because I've done that. But I have done that in the past. There's been times where we have like treats in the back and I'll offer it to my patient. Or I'll say to my family member, you know, we have such and such in the back. Would you like for me to bring you some? Because why not? It's just the right thing to do. Like, you have to, we as human beings, we have to take care of each other, and we have to consistently put good energy out there. Like, if we want this world to be a better place, and we want the world to continue getting better, we have to do good things. We have to think outside of policy sometimes. We have to break rules sometimes, disturb a little bit of what, you know, the institution is saying in order to put some goodness out in the universe. And that to me is what Nurse Amy did. So those two situations, the one where she let the elderly gentleman stay overnight, and this one here with the baby, where she didn't even bat an eye that there was a baby at the bedside, that really sat with me. Like, it really touched my heart. Now, you all know I've discussed nursing being toxic and nurse bullying in previous videos, but remember when Nurse Charlie started on Amy's unit, and I believe she was at the nurse's station, and she saw him in the med room, and it appeared that he was having trouble with the Pyxis machine. But at this point in time, that's what we thought. We didn't know Nurse Charlie was probably in there trying to confiscate some drugs to eventually unalive his patients. But anyway, sitting from the nurse's station, she recognized that, oh, there's a new nurse in there. Maybe that's the new traveler, or that's the new nurse that the manager told me about. Let me go in and introduce myself and see if he needed any help. This lady is amazing, because oftentimes when you're working in direct care at the bedside and you're new to a facility, they might be things that you do not know. And sometimes as a nurse new in that situation, you kind of feel like, oh my God, I have to bother these people again, or I asked them how to do this already and here I am, can't figure it out again, and now I have to ask again. So she recognized that, oh, he might need some help, let me go offer help. And that is the way it should be. Like, nurse bullying, toxic nursing would be eliminated if every single nurse had this kind of behavior and mindset. If you see someone struggling, offer help. If you see a nurse at the Pyxis trying to figure something out, go ask them, is there anything I can help you with good intent. Don't do it and then go gossip about them 10 minutes later saying, oh, you know, I had to go help him work the Pyxis because he didn't know how to do it. But I've raved on and on and on about Nurse Amy, and that's the reason why I think I need to make a part 2, because I don't want to stuff everything into this video. But Nurse Amy eventually helped with taking down Charles, her friend. They actually developed a really close friendship. Like, he supported her during her illness. He would help her out at work. He even got close to her children, and he appeared to be a very good person. But once Amy found out and understood that, wait a minute, this, my friend, is a threat to public health. He is a monster and he is a murderer. She worked with detectives to help take him down. Like, she didn't turn a blind eye and say, well, that's none of my business. Or she didn't say, oh no, I can't do that because he's my friend. She did the right thing. So I just have a lot of respect for Nurse Amy. I actually looked her up a little bit. I don't know if she's still working as a nurse. I believe I saw a clip of her on a news show. I know that she lives in Florida with her family, and I believe she even has grandchildren right now, and she was able to get her surgery. So I was very happy about that. But there are a lot of good nurses out there like Nurse Amy. And, you know, my job as an instructor, what I try to do is teach my students that nursing is much more than a job where you just go in and do assessments and give medications. You have to have a genuine love for people. You have to genuinely care about people, okay? Nursing is not a job that you do for money. There are so many other occupations that you can make money. There's so many other things you can do and make money. To be a nurse, though, you really have to love people. So I'm going to end this right here. I'll follow up with a part 2, and I'll see you guys then. Thank you for watching.